Hello, doctor. I am surprised that you are here still wearing your stethoscope and medical jacket.
Well, I didn't have time to change. What would you like to talk about, Miss Green Bay?
I would like to talk about medications, especially nitroglycerin and sodium nitroprusside.
Well, this appears to be a pretty interesting conversation to have with a beauty queen.
Well, my family doctor recently started me on nitroglycerin. Could you tell me more about this medication?
Sure can. This medication is often used for individuals that have chest pain, otherwise known as angina. It works by dilating the blood vessels in the body. It decreases chest pain by dilating the coronary arteries and allowing more oxygen-rich blood to get to the tissue. This decreases chest pain.
That would make sense. I did go to the doctor and was having chest pain.
Well, Miss Wisconsin, that was a very prudent thing to do.
Now, when I went to the hospital with my husband, he had an intravenous line placed and was given nitroglycerin through this intravenous line. Can you tell me more about this medication when it is given through a vein?
Yes.
Well, tell me about nitroglycerin.
Sure, well, beauty queen. Nitroglycerin is often given through an IV for acute coronary syndrome or to treat individuals that have chest pain. It increases the blood flow to the coronary arteries and therefore decreases chest pain. Chest pain is caused when the body requires more oxygen than it is receiving. Nitroglycerin helps get more blood to the heart arteries.
Does it do anything else?
Yes.
Well, tell me more. I expect you to answer with a response instead of just a yes response. Gosh.
Miss America, nitroglycerin obviously does not improve patient attitudes. Nitroglycerin is helpful in decreasing blood pressure for individuals that are hypertensive. Like I said, it dilates blood vessels so more blood remains in the toes and less goes to the heart.
Tell me more, but do not pause, doctor.
Yes, Miss Universe. Nitroglycerin is also helpful to treat individuals that are in a fluid overload state such as congestive heart failure. It leads to more blood being pooled into the toes and therefore less goes into the heart. This leads to less congestion in the lungs.
I dare you to tell me one more use.
Double dare me because I have it on the tip of my tongue, Miss Galaxy. Nitroglycerin can also be used for individuals that are in cardiogenic shock. You have to.
Are there any reasons why people should not take nitroglycerin?
Miss Manners, I was going to tell you about contraindications. The person administering the medication needs to monitor blood pressure very carefully. It can lead to low blood pressure levels, also called hypotension. It may also increase an individual's heart rate because the vessels will be dilated and the heart tries to keep the vessels full by pumping more often. It can also lead to headaches. Individuals that take performance-enhancing medications for erectile dysfunction should tell their healthcare provider because they can lead to an unsafe drop in blood pressure when taken along with nitroglycerin.
So is there a time when an individual with acute coronary artery syndrome or angina will not be able to receive nitroglycerin?
Yes, if they have a low blood pressure.
And the heart failure patient?
Yes, if the patient has a low blood pressure.
And how about the patient in cardiogenic shock? Is there a time that you would not administer this medication to them?
Yes, miss. If a patient is hypotensive, then they should not be given nitroglycerin unless it is given along with the medication to increase blood pressure. Patients that are hypotensive with cardiogenic shock are often given an ionotropes instead, such as dopamine or epinephrine.
Well, how does it affect the body? I did a Google search and was studying about hemodynamic monitoring. How would it affect a patient's hemodynamics?
You certainly have an interesting talent, Miss Researcher. If a patient had a pulmonary artery catheter in place, we would see that this medication would cause a decrease in afterload, a decrease in central venous pressure, and a decrease in pulmonary artery pressure. We would also anticipate seeing an increase in cardiac output. The downfall is that it can decrease blood pressure as well, so not everybody with cardiogenic shock can take this medication.
I also researched the medication called sodium nitroprusside. What is this?
It is kind of like nitroglycerin on steroids. It is given intravenously and it is a very strong dilator. It is not often given to treat acute coronary syndrome, but it can be given to treat post-operative hypertension and also cardiogenic shock as long as they have inadequate blood pressure.
What kind of complications can you see with sodium nitroprusside?
Hypotension is the most likely response. We also need to keep the medication out of direct sunlight, so you will see it placed in a dark bag. Individuals that are on sodium nitroprusside for a long period of time on large doses can also experience cyanide poisoning.
That does not sound good. How do you prevent hypotension, doctor?
Well, the nursing staff administering these medications will monitor blood pressure very frequently through an automatic blood pressure cuff or with an arterial line. They will increase and decrease the dose based on the patient's blood pressure. They will also infuse the solutions through an intravenous pump.
How do they adjust it if their blood pressure is high?
Increase the dose.
And if their blood pressure would be low?
Decrease or stop the medication infusion.
Sounds like you have a great deal of knowledge about these vasodilator medications, doctor. I will now let you go so that you can play racquetball.
Actually, I was called to help the patient in the locker room next door that had a cardiac arrest. By the way, I really did not receive a proper introduction. What is your title? I obviously noticed your crown.
Oh no. My name is Sally. I just bought the sash and crown at Goodwill. I wear it so that people take me seriously.
Bye, Sally. Time to perform some emergency cardiopulmonary resuscitation.
Bye, doctor.